With around 500,000 Australians suffering from a chronic wound, these hidden afflictions are alarmingly common. So it's crucial to know about all types of wounds and to make sure you have what it takes to assist your patients with a chronic wound. So as we move into Wounds Awareness Week 2020, let's work together to increase awareness of chronic wounds across Australia and spark the right conversations amongst healthcare professionals to not only raise awareness about wounds, but their signs, symptoms, treatment, and if necessary, a focus on early referral for complex wounds. Anyone working in healthcare will come across wounds. Whether you're a doctor, nurse, podiatrist, pharmacist, allied health professional, or a personal care attendant, you will continue to see more and more wounds in the patients you care for, regardless of your professional setting. Minor wounds, such as cuts and scrapes, will usually heal on their own with good wound hygiene and attention, but it's the chronic wounds that resist treatment and are slow to heal that pose the most significant risk. And as the population ages, there will be more people at risk of developing chronic wounds. So what are the wound warning signs? Pain and heat. Wounds that are red, swollen, hot, and painful. Odor. Wounds with an unpleasant or strange smell. Excess fluid, which may be a thick, yellowish fluid. Slow healing. Wounds taking longer than would reasonably be expected to heal. It's also highly important to be aware of the dangers of untreated wounds. Firstly, an open wound can become infected, causing pain and damage to the surrounding tissue. Wounds that are slow to heal are difficult to treat and increase the risk of infection and further damage to surrounding tissue. Untreated wounds can also deepen and become more severe, not only affecting surrounding tissue, but muscles, tendons, and exposed bone. In some cases, where a wound has been left untreated, surgical removal, amputation, of all or part of the wounded limb is necessary. And lastly, an untreated wound can result in bacteria spreading throughout the whole body, causing dangerously low blood pressure, organ failure, and even lead to death. So while not all HCPs will pursue specialist knowledge and skills in wound management, it's crucial that you know what signs to look for and that you're able to assist your patients with slow healing wounds and provide them with the best treatment possible. As we move through Wounds Awareness Week 2020, we will continue the discussion about slow to heal wounds, their signs, symptoms, and treatment. Because at Wounds Australia, we are dedicated to reducing the harm caused by wounds through educating and supporting healthcare professionals and students. So make sure you join us for the next video in this series, where we will be discussing wounds resulting from skin tears and doing a deep dive into how COVID-19 has presented a new challenge in PPE-related wounds. And for resources on wound management, including publications, online learning, e-magazines, journals, conferences, seminars, and wound management courses, visit www.woundsaustralia.com.au.